Welcome, everybody. I'm Dr. Rob Gent, Chief Clinical Officer of Embark Behavioral Health. Feel very privileged to be doing a little bit rare thing for me to be doing the Roadmap to Joy podcast, but this is such an important topic that I wanted to be a part of this, and so fortunate to be able to talk about Major Depressive Disorder today. And our guest is Dr. Georgine Nanos she is actually the CEO of the Kind Health Group in San Diego, in particular Encinitas, California. And we're going to be talking about different types of interventions and things that she's seeing in her practice. And specifically, we're going to be discussing TMS, which is really exciting, Transcranial Magnetic Stimulation. It's a big word, but we're going to be talking about that. So let's just go ahead and jump in. Dr. Georgine Nanos, welcome.
Thank you, Rob. I'm so happy to be here.
Wow, so excited to have you, and thank you for taking the time to us. And I know you've been so gracious. And you said to us in particular, one of my big missions in life is to get out the word on TMS. It's
Yes.
Pretty important to you.
Yes, it is.
Yeah, super great. Well, if I can, before we jump into that, if I'm just a parent listening in for the first time, and you know, I'm sure most of your day-to-day stuff is dealing with parents, and I know maybe talk a little about, you certainly are a board-certified trained physician, and you see parents all the time. Maybe give us a little context about, what is it that you do, and the population you're seeing would be great.
Sure, I'd love to. So I'm a family physician. I'm board certified in family medicine. I've been practicing medicine here in San Diego for over 20 years. And as a family doctor, I see all ages of patients, from infants to centenarians. So I see the whole spectrum of life, which is a unique perspective to see in the course of one's medical career. So and I also treat a lot of families as well. So I have often, the parents, the children, the parents, and even grandparents. So it's a real privilege to see the entire fabric of a family dynamic. And in doing so, I've learned a lot about people and human behavior and the human condition. And what I think some people don't readily realize is that family doctors and primary care providers are really the front lines of mental health care in this country. And so when people are having issues with their mental health, they often will start by seeing their primary doctor.
And I think as a therapist, we forget about this, that the average person goes to see their primary care physician first.
Absolutely. Yes. It's very often forgotten. Much of my training and experience is in treating mental health as well as physical health issues, and they're really interrelated. So I treat a lot of adolescents, young adults, their parents, their grandparents. So I've seen the whole spectrum of patients.
Well, can I ask that seems you tell me what you think, but in my experience, that seems to be the exception rather than the rule. I mean, we talk about the medical model so much of it's seeing it medically it's kind of a linear approach, and we specify a problem rather than, I think what you're talking about is you see things more integratively or more functionally with the person.
Exactly. And that's how I approach medicine as well. I really like to look at the whole person and take into account their emotional and behavioral health as well as their physical health. And as I said, they are very interconnected. And I think when we don't recognize how interconnected they are, that's where we have a hard time figuring out what's wrong with people. And it takes a lot of time to listen and give people the space and time to tell their story.
I would love to hear, Dr. Nanos, an example of, I hear you say people come in. I would imagine that they don't know that they have depression. I would imagine that it shows up in a ton of different ways. I mean, how do you kind of flesh that out? I mean, we deal with teenagers all the time who are like, I have a stomach ache, I have headaches, I have this and that, and come to find out, integratively, it's a combination of a bunch of things.
Exactly. It's very often the case, but as a family physician, our role is to rule out, every other possible etiology of any particular symptoms before we say, okay, this is anxiety or this is depression. What I tell people often is that when we get to that point, and it's that anxiety or depression causing these real physical symptoms, I, I don't want people to misunderstand that and think I'm saying it's in their head. It's not in their head. It's their brain screaming. It's their body screaming what their brain can't say. And so it is really a real. These are real physical symptoms of of an underlying mental health disorder that are super common.
Would you mind saying, like, just if I'm a parent, what are some of those things that you commonly see?
Yeah, absolutely. So in terms of depression, the most common thing is uh, a symptom called anhedonia, which means lack of interest in doing something that you used to enjoy. And if it lasts for more than 2 weeks, it can be a sign of depression. Also, persistent feelings of sadness, hopelessness, physical changes in sleeping and eating, sleeping too much, not sleeping enough, eating too much or not eating enough. So those are some of the more common symptoms. And I think there's still unfortunately a big stigma in our society around depression. A lot of people think that in order to be depressed or truly diagnosed as depressed, you have to be suicidal, and that is most certainly not the case. Obviously, having suicidal thinking is it's definitely a severe form of depression, but it's definitely not the norm. Most people who are depressed are never suicidal, but have these other symptoms, which are super common, especially as I was saying, the most common one is that feeling of just losing interest and not being motivated to do things that you used to enjoy doing, not wanting to get out of bed, that kind of thing.
So if it's super helpful, because if I'm a parent, you're saying, don't let suicidality be the barometer for this thing.
If you've gotten to suicidality, there's a much bigger problem. That's the extreme. So you don't want to wait till your child or your loved one suicidal before you seek help.
But if they're withdrawing, if they're no longer taking interest in the things that used to, all of those things might be a good indicator of go see your primary care physician. Go see somebody that can give you some professional recommendation.
Exactly. And a lot of it, there is a lot of it that's normal teenage adolescent stuff, but I think seeing a professional and getting that teased out and figuring out what the nuances are there are really important, because these kids today are just very vulnerable. Social media is really just eating away at them in every possible way, especially for young girls. It's a very toxic environment out there for them, and a lot of parents aren't even aware of what's going on online.
This brings up a really good point, because I would imagine it gets kind of confusing when we think of depression. We talk about social media stuff, we talk about environmental factors, we talk about developmental factors, and there's also organic factors. I'm sure you're looking at, boy, it's not just secluded to one of those factors. It could be a combination of everything.
Absolutely. And it usually is. And there's also family history, and there's also particular stressors in people's lives. If, their parents are going through a divorce, or if there's some other major stress in the home, that's also can trigger it. So there are situations that can trigger a depressive episode. But the outcome is still the same. Someone is still depressed and needs to be treated regardless of how you got there.
This question comes to mind, and I've been dying to ask you. You've been practicing, like you said, for 20 years. Have you seen an increase? Have you seen what types of increases or what type of trajectory have you seen with the population presenting with depression?
Well, I'm going to say that yes, I have, of
Yeah.
course. So it's I feel like there's a doubling effect almost every year, and
Wow.
and more
Doubling.
so, it's wild to me. Every year, I'm like, how can this get worse? And it's astounding. And COVID certainly really, I mean, I think tipped us over the edge, because we all have trauma growing up, and throughout our lives. There's no escaping that. However big or small it is, um, that affects our world and how we interact with the world. And but then you throw on this collective trauma that we all had of going through COVID, which was a very, as a collective experience as it was also a very individual experience, and everyone reacted very differently to it. And none of it was good for for any of us. And so we have that on top of all the other trauma that we've already accumulated in our lives, and it's caused a lot of profound isolation for people, and really brought to light a lot of underlying mental health disorders that people were just kind of squeaking by with before. Now it's just much more difficult for people to cope.
So you're saying we've seen it. I mean, doubling is just staggering. I know that's true. It's an epidemic at this point in time, and we just see this exponential increase. Maybe talk a little bit about people's. How can we get a better understanding? Because we talk about this thing in the clinical world as major depressive disorder or treatment resistant. How can you help us to explain, like, what is maybe just an onset of mild depression versus a more severe? How do you flesh out what the difference is?
There's actually a questionnaire called a PHQ-9, which is a universally standard questionnaire used by clinicians all over the world as a screening tool and a diagnostic tool for depression. And the questions, there are actually 9 questions, and they encompass a lot of those symptoms we talked about earlier. Anhedonia, lack of interest or motivation to do things that generally bring you joy, sadness, hopelessness, feelings of worthlessness and guilt, as well as changes in your sleep or your eating habits, and then suicidality as well. So there is a score for that, for those answers, and based on that score we can kind of distinguish between a mild, moderate, or severe case of depression, and that's what's most commonly used.
Would you say, just is it best practice if I go see or I take my child to my physician, and is it best practice to do a PHQ-9, or what would you say in the medical field is the best practice?
So best practice really is to screen everybody with those questionnaires, which is what we do in my practice all the time. In addition to that PHQ-9, we also use something called the GAD-7, which is the general anxiety disorder scale, similar type of question, which assesses for symptoms of anxiety as well. So those are standard questionnaires that we screen everybody with in my practice these days, just because it is so prevalent. And oftentimes when people are coming in for, especially young adults, they don't come into the office that frequently. So we want to capture them and make sure that we can assess them and screen them for any of those disorders if they're coming in for, say, or a cold or a routine vaccination or something like that. So it is important that we are screening as many people as possible, because oftentimes these things go undetected.
So let's just play this scenario out. What happens if somebody does score pretty high on these measures? What do you guys do?
Well, it depends. So if someone is suicidal, that's an entirely different situation. Usually that person may need a different level of support. If they're really acute, they may need inpatient hospitalization or something of that nature. If they can be managed as an outpatient, if it's not as severe of a case, generally we talk about the options with parents, which can include a variety of modalities. The first of which is therapy, talk therapy, which is very effective for a lot of people. And then medications, most commonly SSRIs, selective serotonin reuptake inhibitors, or SNRIs, norepinephrine as well, are the most commonly prescribed medications for depression and anxiety. And those are taken typically on a daily basis. One thing that we don't often talk about is exercise. Exercise is an excellent treatment for depression. There've been a lot of head-to-head trials comparing Prozac and exercise, and there have been equal efficacy at times. So so exercise is really important as well. I always emphasize that. And limiting screen time, and particularly for younger people, limiting screen time, and going on a social media diet is also very helpful for a lot of individuals, adults and children alike. So I think we could all benefit from a little more of that. And then some combination of all of those modalities is usually a starting point. I usually tend to avoid medication unless there's a particular need for it right off the bat. I think it's important to try to do everything you can before you go to medication. Not that I'm opposed to it. I certainly prescribe a lot of medication, but I use it only when necessary. And then if that's not working, then we usually talk about accelerated TMS, which is what we also offer at my clinic.
So I'm hearing before you dip into the medications, maybe let's talk therapy, let's look at exercise, sleep, nutrition. I mean, there's a whole host of things we can try to get back on track. That's great.
Yes. We have a whole team of health coaches here at my practice, and we focus a lot on prevention. And the role of the health coaches is really to give people that space and time to have someone to listen to them and kind of hear their story. And that's what that's what we all want. We want that human connection. We want to be heard. We want to know that someone's listening to us. And that goes such a long way. And so that's what we try to provide for people, so that they have someone to talk to, particularly teens and young adults and their parents as well. It's just as difficult for them to watch your child suffer and go through something really difficult that you can't always help with.
So you're opening the door. I can't help but get a little bit excited. I just want to clarify, because this is, certainly from Embark, this is our mission and our purpose. But what you're even articulating as a physician, you're saying, listen, we're storied creatures. We want interpersonal connection. That the fact that we can be suffering depression, feelings of anxiety, all of this stuff, we've actually know that parts of mitigating that is just simple empathy and human connection and being in safe relationship.
Absolutely.
So
1,000%. I can't say that enough. And a lot, when I talk about a social media or screen time diet, that's a big contributor to a lot of what we're seeing, unfortunately. And I mean, I'm just as guilty as an adult of being attached to my phone all the time. And it takes away from that interpersonal human connection. And as we move further away from it, that's exactly what we need more of. We need more of that human interpersonal relationship to fill us up and to help us thrive and find joy. That is the roadmap to joy.
Music to my ears. I can't help but smile. This is so terrific. So just kind of delving into this. So we get cases, and then I love that you're saying when all of that, the pieces are coming together and there's still some depressive stuff. And you mentioned accelerated TMS. So maybe talk a little bit about when do you approach a patient with this? When do you even offer it or suggest it? And then maybe talk a little bit about how that unfolds would be great.
Sure. We have people come to me for accelerated TMS from a number of different avenues. So let me back it up a little bit by explaining what TMS is.
Perfect.
How about that? So TMS stands for Transcranial Magnetic Stimulation. And as soon as I say that, my next words are always, it's not electric shock therapy. It is entirely different. There's no electric current going into the brain. It's using magnetic field energy. So it uses deep magnetic pulses to penetrate into our areas of the brain called the salience network, where our anxiety and depression centers lie for all of us. And what can often happen is, as we are going through life, we encounter negative experiences, which are very common and typical and normal. But what will happen over time for some people is that you will get into these negative loops, these negative thought patterns, and they become these deeply worn grooves, if you will, in our neural network, and become really hard to get out of. And that's when it becomes problematic, when you get stuck in these negative loops. And what TMS is doing is creating new positive pathways to get you out of those negative loops. So it's actually creating new neural connections, new synaptic connections, so that when you're encountering a challenge, a stress, a traumatic event, instead of going to that negative loop, you're going to a positive loop. It's almost expanding your brain in a way to give you more space and time to cope with what is happening. And it helps you to better regulate your emotions, your behaviors, and your thought patterns in a much more positive way. It's non-invasive. It doesn't have any long-term side effects, which is something I can't say about anything else in medicine. And it's a very exciting, revolutionary treatment for anxiety, depression, and a whole host of other disorders as well.
So one is there's research to prove its effectiveness.
Yes, it's been FDA approved for over 15 years. It's actually been around for over 25 years. The reason you probably haven't heard about it very much, or most people haven't, is because when it was first approved back in 2008, it was approved in this very long protocol. The treatment itself only takes about anywhere from 5 to 15 minutes. It's painless. It's a metal coil. It's a coil placed on the forehead. It just feels like a little tapping sensation, and it's a pretty quick treatment. But as it was first approved, it was administered once a day over 40 to 50 days, and it takes at least 40 sessions to get a therapeutic effect. So what you were seeing is people having to come into the office, to a clinic, once a day for 40 to 50 consecutive days, which was really hard for people to do in real life. Outside of research settings, it wasn't happening very often, or people weren't seeing it through to completion, so we weren't seeing the effects that we were expecting. Then about 3 years ago at Stanford, a group of researchers came together to do a series of randomized controlled clinical trials to see if perhaps condensing that protocol to 4 or 5 days would be as effective. And lo and behold, not only was it as effective, it was way more effective.
Wow.
And that became known as the Accelerated, or the Stanford protocol, or the SAINT protocol. They're all the same thing. And that administers the treatment 8 times a day, 8 to 10 times a day. So we're treating patients every hour and giving them a 50-minute rest in between. And this way we're condensing that 40 session treatment in 4 or 5 days. So it's very quick, but it's intense. And that's the only protocol, that's the only TMS treatment that we do in my clinic. It's the accelerated protocol that's pretty fast.
It's so amazing to hear that we have effectiveness for this accelerated process. It happens within a week. It's a very intense 5 days. But Dr. Nanos, tell me, you typically, when you hear about TMS, you hear about a standard protocol taking weeks rather than the accelerated. Maybe talk, why is that we don't hear so much about the accelerated?
It's relatively new. It was only started being used in practice about 3 years ago. It was FDA approved last year, and it's there are not a lot of clinics that have experience doing it. We've been very fortunate to have been doing this now for over a year with excellent results. It's the only type of TMS that we do, so we are quite seasoned in what to expect throughout the week, and we're still learning every week. We learn something new about this whole process. It's just been an immense privilege and joy to be able to help so many people through such difficult times. So for me, it's changed my life, my career path. It's something I want to make available to as many people as possible because it's such an important and incredible treatment.
And I know that you've really taken the TMS and integrated, if you will, all of this other holistic perspective.
Right.
That practice.
Exactly. And that's where we're in a very unique position using our health coaching team, myself, the rest of my team. We really when patients come to us, we treat about anywhere from 3 to 5 patients at a time in the week, and we provide them with a really deep network of support throughout their week of treatment, and then we continue to follow them for a whole year after they've been treated, so that they are getting follow-up with our health coaches, with myself. We have a consulting psychiatrist available for them as well. So it's really a multidisciplinary approach to making sure that people get what they need, and that we get them to where they want to be so they can live their best life. And I think typically in your average TMS clinic, patients will get treated, if they're even going to do the accelerated protocol, they'll just get treated and then they leave and do something for 50 minutes. They may sit in their car or watch TV or something. What we do here is that our health coaches want to really engage our patients to give them tools so that they can use what they've achieved through TMS and help them carry that into their life outside of that week of treatment. So I want people to think of TMS as a very powerful tool in a larger mental health toolkit. So it doesn't stand on its own. The people that do best are the people who go through the treatment and are engaged. They have a therapist. They have a social network. They're interacting and engaging with our health coaches. Those are the people who are going to have the best outcomes.
So wonderfully described, and I think you're hitting on some key point that I want to make sure the listeners are listening to, that it takes this engagement, the best results we're getting at people who are fully participating in it. Let me ask you a little bit of a unique question. Do adolescents, are we treating people younger? Should we be treating people younger than 18?
So it's FDA approved for 18 and above, but typically most clinics will treat patients as young as 12. We have treated younger than 18, but we require a parent or an adult to be there with them. And it is, like I said, it's an intense treatment. They have to be mature enough to be able to be in a clinical setting for 40 consecutive hours, which is a lot for some kids. So it just it depends on the person and the circumstances. We want to help as many people as possible, but it has to be something that's the right fit.
Yeah, totally understand that. What kind of how long do the results last? What are you seeing?
That's again an interesting component of the level of engagement that we see from patients. So some people will go into a lasting remission. So my partner and consulting psychiatrist, Dr. Jonathan Downer, he's treated over 5,000 patients and has done, as part of the trials that helped produce the Stanford protocol. And he will tell you that the remission rate, the length of remission really is highly variable. Some people are in a permanent remission. Some people will need an additional maintenance treatment after a year or two. Some people will need more after a few months. And it really depends on it's such an individual case by case basis. For example, I have a patient that I'm treating again next week who we treated about 6 or 7 months ago. And she was severely depressed with anxiety, and she had a great outcome from TMS. She did really, really well. But then her husband was diagnosed with brain cancer and died a month later. And so she's kind of she's regressed a little bit and is going to be retreated again. And she's really the only person that we have retreated in the last year. But I use the analogy that TMS it's like weightlifting. Without TMS, maybe you can lift 10 or 15 pounds. With TMS, maybe you can lift now 250, 300 pounds. But then life throws you a 500-pound weight. There's only so much you can do there. So she got thrown a 500-pound weight. So we're gonna bulk her up again. So that's the that's the idea.
And I would venture to say that sometimes depression and anxiety sort of put these weird cloud or the goggles in front of your eyes, in the sense of part of the treatment is getting some relief from the symptoms actually gives you an increased clarity, or even an awareness. So I imagine now she's probably like, wow, depression, I always use the analogy is like you're the frog in the boiling water. Sometimes you don't realize the temperature is getting hotter and you don't realize how bad it is until you take a step back.
Oh yeah, and she will tell you, we have actually her testimonial on our website. She will tell you she would have never been able to survive what she went through without the TMS. It
Wow.
would have killed her as well. So um all in all, it was very positive, and it's just, yeah, it's pretty incredible.
So we've got this. Thank you so much. You've described it so well. So we've got transcranial magnetic stimulation. Um, I would imagine you're recommending that before we get into more invasive, heavier type of medications to treat the depression. Look at it holistically, which
Yes.
is wonderfully. If I'm not near your clinic, I should be looking at somebody who does TMS. Let's say I'm a typical family. Is this something that a standard practice TMS would be covered by insurance? How does that usually work?
That's a great question. Well, first of all, we have people coming from all over the country to get treated
Oh,
here.
well,
So we're open to
don't let that
to
stop you.
everyone.
Okay,
Don't
don't
let
let
that
that
stop
stop
you.
you.
We
Yeah.
are in beautiful Southern California, and it's not a bad place to be. We're a block from the beach. But anyway, it's a great question about insurance, and this is a big problem right now. Insurance will sometimes cover the extended protocol, and in order to get that covered, you have to jump through a lot of hoops. Yeah, depending on your insurance, you have to have failed at least a couple of medication trials for a series of months, and then you may get it approved. But only the extended protocol is approved. That 40 or 50, or sorry, the 40 or 50-day protocol is covered by insurance. There, unfortunately, right now is no insurance company that's covering the accelerated protocol, which is a problem because it is a very time intensive and costly endeavor. So it's something that we're working on making more available to more people. At my clinic, we also, for all of our paying patients, we also treat a veteran or a first responder in every one of our cohorts, so that pro bono, so that we can also engage that community as well, and give them some awareness and help them as much as we can.
So a few things I'm hearing if I'm a parent is that accelerated is an amazing option, but at this point in time, not really covered by insurance. But if I have to have insurance coverage, it's the extended version. And to qualify for that, we're looking at needing to qualify as treatment resistant, or,
Right.
we've tried other things and it just hasn't worked, a certain amount of medication. So those are something to consider if you're a parent.
Right.
So let's say we're doing the TMS and I have a family member or I'm a parent. What is the best way that you recommend that family members support people who are doing TMS?
Well, I think first it's important for them to understand what it is and what it isn't. I it's not an instant fix. And so
Hmm.
what will sometimes happen is patients will get treated, and then they'll, go home, and their partners or their family members will be like, okay, is it working? Is it working? Is it working?
Do you feel better? Yeah.
No, really, like every day, 10 times a day, that's not helpful. So we see this a lot. So it's about managing expectations about how this works. It's not, like I said, it's not an overnight thing. It's a cumulative effect that's building over time. We do have cases, and they're rare, where people have an immediate response within 3 or 4 days, and that's always wonderful to see, but that's not the norm. And it's usually after several weeks, even a few months, that you start to get the maximum benefit from it. And again, that is part of a bigger picture of multiple modalities of treatment, the therapy, the exercise, eating right, all the other things that we talk about are equally as important. And so it's that's something that is important for parents and partners to understand as people are going through this. It's not just a quick fix.
Great. I always have to ask this because, if somebody says, hey, Rob, I want to go see a therapist or take my family to a therapist, what are some things to look out for? I would ask the same thing of you, like, hey, if you're going to go look into the scene TMS, are there any red flags that I should look out for somebody who's looking into doing this?
I'm obviously very biased towards the accelerated protocol because I think it just gives you the best results, but there unfortunately aren't enough people doing it right now. And we're fortunate to be one of the few clinics in the United States that's only doing this. So we've gotten to be very good at it. And I just wish we could treat more people and see better results for more people across the country.
So if I'm interested, can I go to your website?
Yes.
No matter where I'm at in the country,
No
I want to learn more about this. No matter
Yes.
where I'm at, where do I go to look at this to see what you're talking about?
You can go to our website, which is www.kindhealthgroup.com. That will also link you to our YouTube channel where we have a lot of videos that explain what TMS is. We have a number of patient testimonials there. We have a huge 24-page document with all of the research studies, not all of them, but a select number of research studies that are the most relevant for people to review and look at. And you can certainly call me, text me, email me. I'm always available for questions.
Careful what you ask for, but yeah.
Oh, I know.
Yeah. Well, one of my last questions is just what is the number one takeaway? If you're a parent, given this whole conversation, what would you say the number one takeaway is for a parent?
Less talking, more listening.
Less talking, more listening. Put down your phone and listen.
Yes.
Listen to your kid.
Yes, listening. It's hard for us to do. I have 2 teenage sons, and I'm constantly peppering them with questions, trying to extract information out of them. And I find if you just sit in the quiet for a minute, they'll start telling you everything. So, especially when you're driving, that's the best, when they can't make eye contact and you can get all the goods.
Well, Dr. Nanos, I can't tell you how much I appreciate it. I know this is our second conversation. We did a podcast called Sessions, where I was so grateful. What I appreciate so much is you're this professional physician and have this amazing practice, but you're also a person and a human. And I'm certainly hearing that interpersonal relationship and all of this is really at the heart of what you're doing.
It is. And it's my roadmap to joy. It really fills me up, and it brings me great joy to have the privilege of practicing medicine and being able to help so many people. It really is my why.
Well, you certainly contributed that today on our podcast. I just so appreciate it. So if you're a parent out there, hopefully if you've listened, get on our website or access Dr. Nanos' website and learn about all of these interesting, effective treatments to help out with depression and anxiety. So if you can, subscribe to wherever you find podcasts, and we look forward to you joining us in our next podcast. Thanks, everybody.
Thank you so much, Rob.